Thank you, Dr. Vandiver. Great to be here today. Thank you. It's glad to, I know I've met the majority of you and your children. So today I want to talk very briefly about what you need to look for as a parent in terms of ensuring that your child has good nutrition and there are not any swallowing and feeding concerns. So I'd like to just go over really briefly the signs of chewing and swallowing difficulties, what happens if your child does have some, and Chrissy performed a swallowing study and there are some difficulties with certain textures of food. And then when do you need a feeding tube? This is not a cause of concern, but I want to talk a little bit about that as well. So first, when I'm performing a nutrition assessment, I'm really looking at how your son and daughter is growing. There are the growth charts. I look for, is your child following the shape of a curve for weight and height? If you're going to doctor visits and you're noticing your child's weight started off at one pattern, it's kind of staying the same over time, definitely if it's dipping down, cause of concern. We would like your child to follow the shape of the curve for good growth. And your child's weight will be dependent upon how tall your child is, what type of energy needs your child needs, lung function, some medications affect metabolism, and such. So when I come in, I assess what your child's calorie needs are. I'm looking at specifically what I mentioned. There are standard equations to predict children's calorie needs per age, but they are definitely not one size fits all. And a standard equation is kind of padded for energy, so that extremely active child who's running around. If our children have weak muscles, if they have breathing difficulties, that lowers the nutrition and the energy needs. So that's a couple things that I take into account. Protein is standard across the board. So no matter what, there's a specific quantity of protein based on age. And typically with children, it's very easy to meet the target goal. It's not uncommon. It's very common for children to eat 2 to 3 times as much protein. So some of the feeding challenges that may or may not be affecting digestion and the GI tract is how we refer to it, gastrointestinal. So if a child, if there's no oral care, say your child is getting fed with a feeding tube and you're not taking care of their teeth and cleaning their teeth, it's very important. Okay, sometimes it's overlooked. Not just a warm, washcloth with water. Let's get some toothpaste in there, do an oral rinse. Reflux is a very common gastrointestinal problem and could greatly affect what your child will tolerate in terms of what type of food, how much, and such. If a child has weak muscles, they can't seal their lips, close their lips properly. The food might be oozing out, affecting how you swallow. That meal times may take a long time. Constipation. If you ever had difficulties with constipation, you'll know if you're not going to the bathroom routinely, you're full. You can't eat. So what is the best case scenario is at least a bowel movement every other day. If your child is going every third day, fourth day, not good. So we have to, if we can't make sure you're hydrated, getting a lot of fruit, vegetables to help along. If we're doing everything right nutritionally, chances are there's a problem with the push. So, get the stool out. So that's where medications come into play to help with that. Your job and my job is to work together, make those stools really soft. And then if the medication's needed for the push, that's where that comes in. And Christy discussed the dysphagia. Okay. Also, the reflux could contribute to vomiting, as you may or may not know. Christy explained, maybe contributing to respiratory infections. I really like to hear, how long is your child eating? Typically we say, let's cap your child off 25 minutes, 30 minutes. Beyond that, it's taking away from quality time with you and the family. So I want you to really think about what are your priorities as a parent. I have some parents that are like, I will feed my child all day, as long as it takes, But then after a while, come back 6 months, you're like, I'm really tired. So I want you to be realistic. with what your energy levels are, because it's very important to take care of yourself as well as your child. Okay, and then the health impacts with the chewing, swallowing problems are, you may not be consuming enough calories to keep up your weight, therefore building muscle. You may not have all your nutrients from your diet, all your vitamins and minerals. Every now and then there'll be a patient that comes in and I'll notice they have chewing, swallowing difficulties, and what they're able to eat are yogurts, oatmeals, and pasta. And I've seen this many times. They're soft textures, they're easy. Applesauce, it's not enough. As you may know, they're white, bland, there's no color, there's no protein. So many things. Dehydration, very careful. It's very important to make sure your child's hydrated. Have something to drink each meal, and specifically in between the meals. If your child's going to school, where's that water bottle? There's no way we could, especially us as adults, we could drink what we need unless we're having drinks in between meals, unless you're drinking a large volume in one sitting. And I know for your children, it's not practical. Chrissy discussed the swallowing issues. I work with her. She tells me what consistency that your child is safe to eat, and then we work together. What does your child like to eat? What are their food preferences? And let's make a complete balanced diet within their food preferences. Okay, so then we have texture. Same thing, we're looking for safe, independent eating, looking at what food choices you as a parent are offering your child. I subtly give you some suggestions in clinic if I know you're missing some foods or vitamin-containing food groups. Chrissy mentioned there's thickening agents for beverages and food. If your child is eating very small portions, just want you to be aware, are they the highest calorie foods that your child will accept? A lot of times your children need moist flavored foods, so gravies, sauces, casseroles are very helpful to help with the swallowing and the chewing. Nutrition supplements always come in handy. This is probably a third of what's available in the market. So these are the most common ones that you'll find in the grocery stores. And there are many others that are available at Amazon.com. All of these are very helpful if your child can't meet the calories and they're able to swallow. Some children get tired after 10 minutes of eating. These could help balance the calories at the end of the meal to make up. Sometimes the children get tired by the end of the day. These might be helpful. Get the solid foods in the morning, and then less chewing, less energy. If your child's going to school and meal times aren't that long, we want to minimize the energy needed to chew and swallow the food. So I would suggest very soft foods to pack for lunch. Don't just pack applesauce and oatmeal or yogurt. Let's get something else that might be a puree in a thermos that could be mashed or such. Who here child has a feeding tube? Okay, and of you, how long did it take you over 2 months to commit to getting a feeding tube? Raise your hand if you struggled with the idea of getting a tube. Yeah, it's a very difficult. When we recommend, we try our best with nutrition, and your child just can't eat what he or she needs, and we need some help. Sometimes the children just can't swallow liquids, and they just need assistance with a tube just for liquids alone, and vice versa. Some may need a feeding tube just for solid foods. So a feeding tube does not mean your child doesn't eat at all. It's a help. So what I'm looking for is, I'm looking at your growth chart. Same thing. Is your child not able to maintain their weight? A textbook definition after 3 months, if you're putting a very good effort into feeding your child, giving it your all, and you just can't do it. So here's an example of a growth chart where there's some problems getting enough calories in. And then I want to show you what a feeding tube is. When I first started out as a dietitian, I worked with a nurse who is, bless you, who is called the G-tube nurse. And I use her example all the time. A feeding tube in the stomach is like an earring. So you make a little incision in the stomach. There's an anchor in the back, which is we call the balloon, that's filled with water. And then there's the outside portion. The picture on the right is a button. So after a G-tube is placed, you'll have the extension, the cord. And when that site heals, a doctor may recommend the button because it's flat and you don't really see the chunkiness outside of the, with the clothes. So these are some examples. The middle is what typically is first placed with a feeding tube, and then we convert to a button afterwards as well. So your child could take a bath, go to the beach, go in a pool. There's no restrictions with the tube. You only care for it, soap and water, okay? I did hear sometimes if a child is getting a cold, it may be typical for it to ooze a little bit, but clear fluid, and that's it.
Sorry.
So just some examples to upgrade nutrition. We want to optimize. I love that word. We want to make sure we get power nutrition. So let's go through some scenarios. This is okay food. Adding some fruit is better. Let's add some ground up nuts, even better. Do we want to make it 600 calories? Let's add some nut butters. Okay? So we go from 110 calories to about 500. So all different levels for what your child's energy needs are. Make sure if your child is all puree, who wants to look at puree oatmeal texture all the time, each meal? We want fun. When you go out to eat at a restaurant, they appeal to us for the plate presentation. We want a beautiful plate. So kid-friendly. I'm sure you smile when you see these too, okay? Make it fun. Even if your child has all puree, still offer this in front of them and then serve the puree on the side. Fun, soup, fruit. Here we go, pizza or a breakfast item. Could be yogurt with some fruit. Beautiful parfait. Puree food. There's many frozen fruit and vegetables. Very easy, quick and easy, and fast. Take out of the freezer, put in a blender. That's fine. You could add a little juice. Better yet, some milk or non-dairy milk. A wonderful parfait. We're going to celebrate Halloween soon, so I had to put a pumpkin flavor, pumpkin puree with some ground graham crackers at the bottom, very soft texture, and you could layer it with yogurt pudding. Again, make it nice and fun looking. And then texture, I'll know, can your child bite a chunk? Do we need the cut up, cooked soft food? Or at the end, do we need a puree? So we have to think, how are we going to present within the ability to chew and swallow? I mentioned casseroles are very good. They're nice and moist, easy to swallow. This is a very popular infant, toddler, and I challenge you to have it as an adult snack. High energy. Half portions of avocado banana. Could upgrade with a little honey, add a little powder to it, like a flavoring like chocolate or such like that. Make it a really yummy dessert. Here's some fruit mixed with that as well, or chunks. Okay, so macaroni and cheese is very popular. Make sure you add some carrots or broccoli on the side, meatloaf and potatoes. Here we have some blenderized smoothies. You could think when you blenderize fruit and vegetables, you have like 7 or 8 fruits potentially in one container. There's a lot of over-the-counter products that are natural. They don't add the extra sugar in them as well. Here's chia seeds, very popular. They're known from like the Aztecs, like an energy source. I read they used to eat them in gobs before a battle for energy. So they're very constipating if you eat a lot of them. So make sure you get enough of liquids. But they're great for omega-3, omega-6 fatty acids, great for the nervous system. There's some fiber and B vitamins as well. And if you're in the United States, you could locate a dietitian on our website if you're not familiar where one is in your neighborhood. Okay?